The intricate relationship between mind and body has fascinated medical professionals for centuries, yet only in recent decades have we begun to truly understand the profound impact psychological factors can have on physical health conditions. This complex interplay represents one of the most significant challenges in modern healthcare, where traditional boundaries between mental and physical medicine continue to blur. Psychological factors affecting other medical conditions encompass a broad spectrum of mental health influences that can either exacerbate existing physical ailments or contribute to the development of new ones, creating a cascade of interconnected health challenges that require comprehensive, integrated treatment approaches. Stress emerges as perhaps the most pervasive psychological factor influencing medical conditions across virtually every system of the human body. When individuals experience chronic stress, their bodies remain in a constant state of heightened alertness, flooding the system with stress hormones like cortisol and adrenaline. This persistent activation of the stress response system can wreak havoc on cardiovascular health, leading to elevated blood pressure, irregular heart rhythms, and increased risk of heart disease. The immune system, too, suffers under prolonged stress, becoming compromised and leaving individuals more susceptible to infections, slower wound healing, and reduced vaccine effectiveness. Gastrointestinal conditions frequently worsen under stress, with patients experiencing increased symptoms of irritable bowel syndrome, acid reflux, and inflammatory bowel diseases. Depression represents another powerful psychological factor that significantly impacts physical health outcomes. Individuals suffering from depression often experience disrupted sleep patterns, altered appetite, and decreased motivation for self-care activities such as medication adherence, regular exercise, and proper nutrition. These behavioral changes can profoundly affect the management of chronic conditions like diabetes, where consistent monitoring and treatment are crucial for optimal outcomes. Depression has been linked to increased inflammation throughout the body, potentially accelerating the progression of cardiovascular disease and contributing to the development of autoimmune conditions. The relationship between depression and pain is particularly complex, with psychological distress often amplifying the perception of physical discomfort and reducing pain tolerance. Anxiety disorders create their own unique set of challenges when it comes to medical conditions. The physical symptoms of anxiety, including rapid heartbeat, sweating, and muscle tension, can mimic or mask underlying medical conditions, making accurate diagnosis more difficult. Individuals with anxiety may avoid medical appointments or procedures due to fear, leading to delayed treatment and worsened outcomes. The hypervigilance associated with anxiety can also lead to excessive focus on bodily sensations, potentially amplifying symptoms and creating a cycle of increasing distress. Panic disorder, in particular, can significantly impact cardiovascular health, with some studies suggesting increased risk of heart problems in individuals who experience frequent panic attacks. The concept of health anxiety or hypochondriasis illustrates how psychological factors can create a self-perpetuating cycle that affects medical conditions. Individuals with health anxiety may engage in excessive medical testing, seeking multiple opinions, and constantly monitoring their bodies for signs of illness. This heightened attention to physical sensations can actually increase the perception of symptoms, leading to more medical visits and potentially unnecessary procedures. The stress of constantly worrying about health can itself contribute to the development of physical symptoms, creating a paradoxical situation where the fear of illness may actually contribute to poor health outcomes. Personality traits and coping mechanisms play crucial roles in how individuals respond to and manage medical conditions. Individuals with type A personalities, characterized by competitiveness, urgency, and hostility, have been associated with increased risk of cardiovascular disease. Conversely, those with optimistic outlooks and strong social support networks tend to have better health outcomes across a wide range of conditions. Coping strategies significantly influence disease progression and treatment success, with problem-focused coping generally leading to better outcomes than emotion-focused or avoidance-based approaches. The phenomenon of psychological stress manifesting as physical symptoms, known as somatization, represents a particularly complex area where psychological factors directly affect medical conditions. Individuals experiencing somatization may develop genuine physical symptoms without identifiable organic causes, or their psychological distress may exacerbate existing medical conditions to a degree that seems disproportionate to the underlying pathology. This presents significant challenges for healthcare providers who must carefully balance the need to address psychological factors while ensuring that genuine medical conditions are not overlooked or undertreated. Trauma and post-traumatic stress disorder, PTSD, create lasting impacts on physical health that extend far beyond the initial traumatic event. Individuals with PTSD often experience chronic pain conditions, gastrointestinal problems, and cardiovascular issues at rates significantly higher than the general population. The dysregulation of the stress response system following trauma can lead to chronic inflammation, altered immune function, and increased susceptibility to various medical conditions. Additionally, trauma survivors may engage in risky behaviors such as substance abuse or self-harm, further complicating their medical care and overall health outcomes. Sleep disorders represent another critical area where psychological factors significantly impact medical conditions. Depression, anxiety, and stress can all contribute to insomnia and other sleep disturbances, which in turn affect the body's ability to heal and maintain optimal function. Poor sleep quality has been linked to weakened immune function, increased inflammation, higher risk of obesity and diabetes, and cardiovascular problems. The relationship between sleep and mental health is bidirectional, with poor sleep contributing to psychological distress and psychological distress contributing to poor sleep quality. The emerging field of psychoneuroimmunology has provided valuable insights into how psychological factors influence immune function and subsequently affect medical conditions. Research has demonstrated that chronic stress, depression, and other psychological factors can suppress immune function, reduce the effectiveness of vaccines, and slow wound healing. Conversely, positive psychological states and effective stress management techniques have been shown to enhance immune function and improve outcomes for various medical conditions. Treatment approaches that address psychological factors affecting medical conditions require integrated, multidisciplinary strategies. Cognitive behavioral therapy has shown effectiveness in helping individuals manage chronic pain, improve adherence to medical treatments, and reduce the impact of psychological factors on physical health. Mindfulness-based interventions, stress reduction techniques, and relaxation training can help individuals develop better coping mechanisms and reduce the physiological impact of psychological distress. The integration of mental health professionals into primary care settings has shown promise in addressing these complex interactions between psychological and physical health. Understanding and addressing psychological factors affecting other medical conditions represents a crucial frontier in healthcare that requires continued research, education, and clinical innovation. As our understanding of the mind-body connection deepens, healthcare providers must increasingly adopt holistic approaches that recognize the inseparable nature of psychological and physical well-being. This integrated perspective not only improves patient outcomes, but also offers the potential for more effective, compassionate, and comprehensive healthcare delivery that addresses the full spectrum of human health and healing.